My staff, most of them have been with me for a long time, at least on average 5 or 10, or one of them is at least 18 years with me. So we don't have a high turnover rate. And patient-wise, the same thing. It's all been mostly all long-term patient. So that's why it's important for me to provide the general practice, keep that going. But at the same time, the demand for the implantology, the implant dentistry, is growing tremendously. Implantology came about really in the early 90s when I was doing restorative for my patient on implants after they had the implant placement. And I just found it fascinating that why do I have to break it apart, and I should make it more convenient for the patient to just come to one place, which is my office, and be able to do the whole thing. The main thing is they're comfortable with the dentist, one doctor, and once they establish that relationship, it's hard to just jump around to go to different doctors to do, especially a somewhat invasive procedure, and not knowing or developing a rapport. The procedure has really improved over the years, especially in the last 10 years. The dental implant field has really has developed, I think, for the better of not just the practitioner, but for the patients too. It's important that we use really the top of the line, the best product, and provide a service that the patients look for. If it's a straightforward standard case, let's say we're just putting the surgical part, one implant, into the missing tooth area, on average maybe between 5 or 10 minutes. And just recently we had a patient that she saw all the tools on the table before she sat down. She said, "Oh, I'm going to be here for a few hours, huh?" And I looked at her, maybe, and then about 10 minutes later, I told her we're done, and she looked at me. She says, "Are you kidding me?" She says, "Aren't you going to do something to me?" I said, "We did already," and so she was really excited.